Hi, my name is Lauren Buck, and today I'm going to be talking to you about a career in applied health psychology. So today we're going to be talking about the definition of applied health psychology and its evolution, the personal importance of pursuing a career in applied health psychology, the credentials needed for applied health psychology, and the salary and working conditions for an applied health psychologist. Health psychology examines how biological, social, and psychological factors influence health and illness. Health psychologists use psychological science to promote health, prevent illness, and improve healthcare systems. The three most common fields for applied health psychology are clinical work, research, and public policy work. Essentially, applied health psychology is more interactive. A primary focus of clinical health psychology is the development of effective disease prevention behavioral interventions for populations at high risk for medical problems. A second focus of clinical health psychology is the development of strategies to help individuals who are already ill to manage their disease, increase their ability to collaborate with medical professionals, and improve their coping skills. Typically, a bachelor's degree for psychology students is considered a stepping stone. The top occupations for bachelor degree students in psychology are sales representatives, advertising agents, psychiatric technicians, career counselors, probation and parole officers, writers, market researchers, child care workers, laboratory assistants, social service specialists, or teachers. According to Kendra Cherry, an author and educator of psychology. The following information was also derived from Kendra Cherry. She mentions the three segments that are listed for top occupations for master's degree graduates. The first is jobs in local, state, and federal government. These kind of job positions that you would fill are such as developmental specialist, employment counselor, drug and alcohol specialist, parole officers, or rehabilitation counselors. The second is jobs in healthcare and mental health services. These job titles include behavioral counselor, psychiatric technician, group home coordinator, or family service worker. And for the last, jobs in business, sales, marketing, and advertising. These job positions are such as project manager, store manager, market researcher, or employee trainer. As you can see, jobs available with the completion of your bachelor's degree are not as interactive with psychology as job positions available with your master's degree are. However, in order to be completely immersed in psychology in every aspect, getting your PhD would ensure this. According to the U.S. Department of Labor, the top industries that employed most psychologists are elementary and secondary schools and state, local, or private sectors, offices of mental health practitioners, hospitals in state, local, or private sectors, and individual and family services. Instead of listing general PhD programs, I'm going to discuss my program of interest at the University of Colorado Denver for clinical health psychology. According to the University of Colorado Denver, their program adheres to the scientist practitioner model. Training emphasizes the contribution of research to the understanding, treatment, and prevention of a wide range of health-related problems, and the application of knowledge that is grounded in scientific evidence. Students are trained in a variety of approaches and techniques for evaluating, diagnosing, and treating a wide range of psychological disturbances. Since their program places an emphasis on health, students are also trained to assess the psychological factors associated with different medical problems and learn to design effective interventions that integrate biological, psychological, and social factors. Students acquire research expertise by completing a master's thesis and doctoral dissertation and demonstrate competence in clinical assessment and intervention through several applied practica experiences, a clinical competency evaluation, and a predoctoral internship. The CHP program is accredited by the Commission on Accreditation of the American Psychological Association, also known as APA. The following information was gathered by the Psychologist Occupational Outlook Handbook, accessible through the U.S. Bureau of Labor Statistics. According to the Occupational Outlook Handbook, the industries that have employed the most psychologists were government facilities, hospitals, schools, offices of mental health practitioners, and individual and family services. Beside each industry is the annual salary for psychologists. Work schedules were also mentioned as followed. Psychologists in private practice often set their own hours, and many work part-time as independent consultants. They may work evenings or weekends to accommodate clients. Those employed in hospitals or other healthcare facilities may also have evening or weekend shifts. Most psychologists in clinics, governments, industries, or schools work full-time schedules during regular business hours. I'm interested in a career in applied health psychology because my aspirations in life are to help people and promote healthy behaviors. The reason I'm being general when I say I want to pursue a career in applied health psychology is because I've yet to find a program for my PhD It truly captures everything that I want to accomplish. I read an article by Richard Jenkins in which he discusses his experiences of how adaptations to psychology are, quote, occurring in other applied areas of psychology and in applied areas of other social science disciplines, end quote, Jenkins, 2010, over the span of his career. He mentions that there are more options available and different subcategories in work environments than there previously were. My ultimate goal in health psychology is to have a holistic approach. This means evaluating several aspects of someone, such as their mind, body, spirit, and environment, instead of focusing on only one of the attributions. I feel that humans are extremely complex, and to simplify or negate different aspects of an individual's life is just an unacceptable practice. I feel that clinical health psychology is probably the closest description of an ideal career interest that is available. However, with the way that psychology is evolving, I hope that by the time I begin my PhD, something with a larger focus on holistic practices will be available.